I'm very pleased with the introduction to tonight's topic because I, just in case my background isn't clear, I'm a GP trained in UCD, qualified in 1980, so that was when I was 24. I still feel 24, isn't it weird? But the reason why we're here is because of marijuana, cannabis sativa. And because cannabis sativa has taken such a huge space in terms of legislation and the whole, getting bound up in the whole legal system, the hemp plant itself has been totally overlooked. And hemp is used as a whole plant. The CBD is extracted as part of the whole plant. But all of the research is actually because of the cannabis sativa, which is the marijuana plant. It has been used for millennia. The endocannabinoids, the system of endocannabinoids in our body, which is supported by some of the constituents of the cannabis sativa, go back to millions of years ago. They were part of the whole evolutionary, some of the most ancient evolutionary adaptogenic mechanisms are involved in the endocannabinoids. So that was a very nice introduction because hemp is just one plant. If I was to think of a couple of plants there that have a lot of overlap, it would be nettles, because you make fibre, cloth. They're very structurally supportive. They're full of vitamins and minerals. Doesn't have the essential fatty acids and doesn't have the cannabinoids. We'll be going into other plants that have cannabinoids or pre-cannabinoids, and also the complexity of the whole system, which is just mind-boggling. So it's complex. I'll simplify it as best I can. I'll just head on from there. If I can find the PowerPoint now, because we haven't done that. Oh, here we go, exit. And here's the PowerPoint. Thanks a million. And there's the thanks a million. It's funny, once you start, it's actually hard to go. That's grand. Cannabinoids. So I'll tell you what the plan is. I'll do a general introduction, and then there are various kinds of cannabinoids, endocannabinoids, which are our own cannabinoids and what they influence, and then phytocannabinoids, which includes CBD. So it's only one of a whole group of cannabinoids, and it's research on how to use it and what any concerns might be about it. And then at the end, we'll feed the birds. They've been extensively studied because of cannabis. Endocannabinoids are our own cannabinoids. So you make your own cannabinoids. Very similar to endorphins. Are you all familiar with endorphins and when you hit the wall with extreme exercise, or it's a feel-good factor? We have our own system of endocannabinoids which play a role between the nervous system, the immune system, etc. But I go into that. But we do make our own, right? And that's what we want to support. And then plants make them for us as well. So the only thing exceptional about the cannabis sativa is that it seems to be the only plant that produces the psychoactive cannabinoids. But what we're talking about has no psychoactive properties. So they have a lot more in common with other plants than with the psychoactive in cannabis. So we look at the research on endocannabinoids, the phytocannabinoids. There's another group called synthetic cannabinoids, which is what they'd all like to do. Making medical cannabinoids from plants is very expensive. But that's because we don't really invest in growing plants. It's much easier to invest in a factory that makes synthetics. So there's a lot of logistics around it as well. All research involves history, toxicology, constituents, laboratory, such as a beaker or a petri dish, which is these ones here, living cell lines, animal research, healthy people, and then clinical studies. Most of the research into cannabinoids takes place in understanding the constituents, laboratory or beaker, petri dish, some living cell lines, very few animals. So the further you go down the list, the less the research is into CBD. But first and foremost, the hemp plant gives us hemp seeds, and hemp seeds are very nourishing. So the one thing to go home with tonight is to put hemp seeds into your diet. And that's because they are rich in, oh yeah, I didn't put this on a slide because I'll ask you this at the end of this. So this is canvas derived from cannabis. It also makes cloth, canvas, sacks, ropes, and sails. Okay, it took 120,000 pounds of hemp. This is the USS Constitution, and it was rigged out entirely using hemp. This was before the hemp plant was made illegal, as I said, getting involved with the whole thing about the cannabis. So what we're talking about is a wild plant. So the wild plant that we know of the rose family is the Rosa canina, which is the one on top. A cultivated one, which might be cultivated for its prettiness, for the long flowering season, for its scent, and for all of the cultural reasons that we associate with flowers over the centuries. Roses have always had a lightening influence on us physiologically, and the scent and the perfume, and it's a medicinal herb. I use it a lot for people who have had very bereft childhoods for one reason or another, or who keep doing the same pattern of behaviour, which is not very helpful to them. The rose plant is one of the most reassuring. I use it a lot in children who are nervous. It's soothing for the digestion and soothing for the nervous system. We cultivate plants for various reasons, and it's exactly the same with cannabis sativa. There are so many hybrids that have been created for different reasons and to produce different effects on the body. So this is what it looks like when it's growing. It's very unexciting. It looks like a field of nettles, right? There's nothing terribly glamorous about this as a plant. This is what it is like, right? I can pass this around and I'm a great believer in the touchy-feely sense of, this is it dried, which is what the oil would be extracted from. And you can see the seeds. And the extract can be by using all of the plant and extracting just the CBD. So let's get a little bit more serious. There are two receptors, CB1 and CB2. That's not too difficult. CB2 does not act on nerve cells. It does work in the nervous system. It works on all of the other tissue in the brain and spinal cord, and that's involved in the nervous system. But it doesn't, it's very important. This is the reason why it doesn't have a psychoactive effect. But some of the other reasons of it working on the brain tissue are very important for its effect on the immune system and the inflammatory system. So a receptor is something that fits like a hand in a glove. And that's what activates the mechanisms in the cell wall. Okay, do you all get that? You're fairly familiar with it? So the CBD has an influence on bioregulation of just about everything. Why is it good for everything from acne to Parkinson's to fibromyalgia to any chronic degenerative process? Because it's involved in the bioregulation of just about everything. But that's not unusual for plants either. You know, I've seen St. John's wort come and go in its heyday. I've seen ginkgo come and go in its heyday. Now we have cannabis sativa, extract of CBD, and this is the plant of the day. Live long enough and you'll see everything come around at least once, and then come back in fashion again. All of these plants are useful. And one of the most important things is that plants are useful together. You don't make your soup with just carrots. You add in some onions and some garlic, and that's how to make a healthy soup. So it's exactly the same I don't get terribly excited about the plant cannabis sativa, only because it's diluted about equal excitement about 90 other herbs. I just couldn't contain myself getting up in the morning if I was to get overexcited about any one. The herbs I get really excited about are dandelion root and nettles and St. John's wort. And these are yet another cog for chronic degenerative diseases. So they bioregulate just about everything in common with garlic, okay? They do have a specific role. I am under-hyping, if you like, in reaction to the overhype. Some of the exciting things, I get excited because I love the science of it. They signal adjacent cells. So if you imagine that a nerve cell with a very long axon, right? A nerve cell is like a very stretched out cell which goes at 100 miles an hour or 1,000 miles an hour. The endocannabinoids, they signal the cells next door, okay? So instead of going on the motorway from here to Belfast, you do jog each town along the way and you go the slow way. So they're made from fatty constituents of cell membranes. So that's one of the reasons why hemp is very good for you, because it actually produces some of the essential fatty acids that are necessary for cell membranes. So do sardines. Okay, so this is to kind of put it in perspective. They're made on demand. So according as your body needs them for bioregulation, that's when they're made, so long as all the constituents are there. And they're not stored. They have a breakdown after 3 or 4 hours, but that's not unusual either. This picture here gives you, this is the cell membrane, and these are things trying to get through the cell membrane. So this one is penetrating through, and this one isn't quite getting there. And this is a phospholipid membrane. So anything that's oily will go through, anything that's not oily, it's got variable permeability. And it's a very, very complex system. But having the constituents are one of the most important things for transmitting signals. So the inflammatory response. There's 2 things that are important in all of these chronic degenerative conditions. One is the gut, and the other is the inflammatory response. The answer to everything from a herbalist point of view is the gut. The same way as an estate agent will go location, 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 a herbalist will go digestion, digestion, digestion. And for all of the chronic inflammatory conditions, this is exactly the same. But if you're taking a supplement, what do you want to have in good order? Digestion. Because if your digestion is, you could be taking supplements until the cows come home, but you won't be absorbing them terribly well. So the gut is very important even for that reason. There's a COX-2 precursor of the inflammatory response. I don't know how many of you are familiar with things like prostaglandins, prostacyclin, thromboxane, leukotrienes. These are all involved in the inflammatory response for allergies, fever, and other immune responses, and also for controlling blood pressure. So bioregulation of just about everything. This just shows you the pathways. This is the COX-2. See the cyclooxygenase? That's what's blocked. And if you block that, it affects the prostaglandins and the thromboxanes, etc. And the link is with the arachidonic acid. So, look at this one. Look at this one. Any idea where it fits in? I don't. And this is why I brought this. This is a very important prop. If you take that map, okay, and you wrap it around this, you imagine it's wallpaper, and you wrap it around this, and then you get some more of the same pattern wallpaper, and you scrunch it all up, and you put it inside the beach ball, because all of these are happening inside the beach ball as well. This is 3-dimensional. When you read your science, it's reducing all of this complexity into lines and arrows. And it doesn't work. In that plan, can you see where imagination lies? can you see where falling in love lies? And where's grief? And where's just the ordinary day where you're happy enough, fed well enough, you know, like your everyday. How does that relate to how we live our lives? Okay, so if we look at the science, it doesn't give the feeling of a live plant or a person living their lives through all of their different experiences. So it'll never add up to what exactly medicine does, in my opinion. Okay, there's a link that's missing. So, and I wanted to say that tonight because I'm going to go through quite a number of these pathways, right? There's common core ones. And in science, when somebody is involved in one little one over here, the science all makes sense. And somebody else is involved in this pathway over here, and that makes sense. But I don't know of any scientist who can hold all of that in their head and all of the linkages, and that's just on a flat page. And I don't know any scientist or pharmacologist or consultant knowing what the effect is of 5 drugs. And 25% of our population over 65 is on 5 or more drugs. Okay, so that's, when I talk about herbs being complex, they have this multiple complexity as well. So having one very strong synthetic drug influencing some of these things and then adding in another one. So that's one of the reasons why natural medicines need their place. Okay, does that make sense? But I'm also putting in, because I'll be talking a lot about these pathways, and they only go so far. And the biggest evidence we have that CBD is useful is that we've been using it for thousands of years. All right, and I'll show you this in some of the later slides. So inflammation, why do I get so excited about digestion and inflammation? Digestion, because I don't know of any chronic degenerative condition which is independent of poor digestion somewhere along the way. But inflammation is connected with all of these. So anything that affects inflammation in a very complex way, by several different pathways, can have an influence on all of these. Just in case you didn't believe the first slide. They're now realizing that there is a huge immunoinflammatory overlap in mental health. So depression really isn't all in your mind. A lot of the patterns of depression for many people overlap with immune complex regulation and also genetics. So it's mental health really does matter, and there is logic and rationale. I like when the science and the history all come together. When you add in the epidemiology, and I'll come to a concept later on, which is proof of principle, which really kind of puts that in perspective. If you have chronic inflammation, see a medical herbalist, because it's not as simple as just taking. Why is it difficult to take on board natural medicines? One is because we've been mind-molded, that drugs and tablets are the first go-to. That's what we've all been taught. That's the experience, that's the ads, that's all the things that are around us. But also, it's easy, isn't it? It's easy to take a tablet. Do I have a herb that's that easy, that is the one thing that will kill your pain? No, but that's why I see people when all the other things don't work. So if I was to give you another big tip, go and see a herbalist early. Go and see a herbalist if you have chronic digestive problems. And work out what it is that's core. The digestion is what's getting your attention. The chronic inflammation is getting your attention. But you need to work out how to build up good building blocks so that you can avoid problems. Yeah. So gut is key. Any of you have been following all of the recent knowledge about microbiome and small intestine bacterial overgrowth and leaky gut syndrome and chronic fatigue? It's all there. The physiology is now catching up with what medical herbalists have always called the terrain. If you want a scientific name for it, it's the psychoneuroimmunohumoral balance, which is where they got all of that underground system of biochemistry, and they started realizing that, hey, Jesus, they're all linked up. Cut the Jesus. So endocannabinoids are a central mediator for the fight or flight. So all of the things that keep us frazzled and make us feel as though we're being chased by a bull. Other countries, they say a tiger, but we don't have too many of them in Ireland. So we're racing through our lives as though we're being chased by a bull. It's an imaginary bull, but imagination doesn't come up on those bioregulatory pathways. We act as though that's what's happening. And endocannabinoids have a big role on that. So we're looking at what are the effects of our own cannabinoids? Bear that in mind. This is the effects of our own cannabinoids. They have effect on blood pressure, blood sugar, fat around the middle, and raised cholesterol. This is what's called a metabolic syndrome. And it's, again, fundamental to a lot of chronic inflammatory diseases. So it amuses me that at the end of a lot of the research, it describes, this is a new method of dealing with inflammation, a new way of dealing with mental health, a novel ways of affecting this bioregulation. And new, it might be lots of clever things, but it's not new any more than nettles are new. The role of endocannabinoids is an ancient signaling. It's evolved over 500 million years. The only way I could depict that was these old texts, but it was a million years before the texts. Yeah? Not psychoactive. They're described as promiscuous compounds, which I thought was a lovely description, meaning that they affect many different pathways. They enhance feel-good and they modulate inflammatory effect. Now, this is one example of how complex it is. So it's critical for sex hormone release and sex biosynthesis. So all of the reproductive hormones from the hypothalamus and the pituitary in your brain down to your gonads. It's necessary for eggs and sperm. It's necessary for fertilization, necessary for pre-implantation, embryo development, implantation, and post-implantation embryonic growth. It's good for labor as well, and they're involved in neuroendocrine control of functions, not only those direct effects, but also effects beyond stress, food intake, appetite, and sexual behavior. Because you ain't going to get pregnant if you don't feel like having sex. So, and I chose that just as one example. Okay, so our endocannabinoids are deeply embedded in that whole underground system. And this was the best I could do for an illustration of what a promiscuous constituent might look like. When you involve the next cell and the next cell and the next cell, and then that triggers a cascade in some other system, and that cascade bumps into another one, and you're into the beach ball. Okay? So, are we all still here? Are we all still motoring? Okay. I wanted to be an actress. There. So, they were our endocannabinoids. You all got that? That's our own cannabinoids. I was getting muddled by the time I finished this. These are about phytocannabinoids. So remember, who can remember what phyto indicates? Plants, yeah. So these are plant cannabinoids. Does anybody know what that flower is? Echinacea? Yeah, Echinacea. So Echinacea interacts with the CB2 receptor, same receptor. Okay? It regulates your immune system, pain, and inflammatory response. Did I know that already? Yes. Did I know it was due to endocannabinoids before I started researching this? No. So thank you all very much. Did I know that it wasn't just an influence on the immune system, but that it was also the anti-inflammatory response and fighting off infection before it starts? All right? Because the key thing with Echinacea is the minute you get sick, The minute you get, I think I'm going to get sick, that's when you take the Echinacea. This explains why, doesn't it? Because it's the boxing gloves, so that you're actually beating them before they get over-involved with you, okay? So the most important time to take Echinacea is when you go, going to get the sore throat, I'm going to get the cold, I'm going to get the sinuses, I'm going to get something nasty, all right? Cellulitis, urinary tract infection, whatever it is. You take it the minute you have it in the house. Don't wait until you get symptoms on a Sunday and you have to wait till Tuesday before you can get a supply. And they're just the particular chemicals for anybody who wants to know. All the plants with beta-caryophyllene, which is a volatile oil, basil, cinnamon, cloves, oregano, and black pepper. Black pepper is interesting because a great combination for CBD is with turmeric. And turmeric has a lot of the same anti-inflammatory. I could do an equally exciting talk here about turmeric, right? But turmeric and black pepper enhance each other. But if you were to use turmeric and CBD and black pepper, and you had cloves in your chai, and you had oregano in your meatballs, wouldn't that be a great combination? Okay? So there's no magic. If you're coming for a magic formula that you just take for 20 days and everything goes away, you're not in the right place. You can leave now. Two herbs that we use as herbalists are rue and wild carrot. Wild carrot is very interesting. Those two photographs are of wild carrot. So you'll see them all along by the golf course, or what used to be the golf course out by the back prom, beyond the diving boards, all along the coast. So there's lots of it around. It's one of our wayside plants, and it's used for particularly kidney pain. But when I actually did a big kind of research into it a few months ago, and I thought, my God, why am I not using this like all the time? Because I came up with the traditional use is anti-inflammatory and pain, which is very nice if you've got renal colic. The volatile oils are also antiseptic. And I think it's a herb I'll be using an awful lot more from now on. And a good combination is wild carrot with nettles. The other plant that's rich in phytocannabinoids is Theobroma cacoa. I used to think that chocolate would have stimulated the serotonin receptors, because it definitely has a craving, mood, brain-altering effect. I was wrong about the serotonin, but I was right that it did have a physiological effect, and that's why we've all been self-medicating on chocolate. The good news is the chocolate is effective. The bad news is leave out the sugar and the powdered milk and the dairy. So how it works, for those of you who want to know, insofar as we know at this time, remember 15 years ago we knew bugger all about endocannabinoids, what will we know about in 15 years' time? So that's like everything, it's a process evolving. So anandamide is an endocannabinoid feel-good factor, and what the cannabinoids in the chocolate does is it stops the breakdown, so the anandamide stays around longer. Good to know. It's also rich in iron, so nothing wrong with a bit of dark chocolate. Black pepper, lash it in with the turmeric, okay? It's the active ingredients are terpenes. They act like a cannabinoid. Research suggests anti-inflammatory and helpful for osteoporosis and osteoarthritis. Now, there's a few slides I put in detail because they illustrate points. So this one is, although it's tempting to believe that these compounds exert beneficial effects in humans, clinical evidence is lacking. Future studies will have to determine whether there are additional apparently non-toxic CB2 receptor selective ligands in plants other than cannabis, and whether they could be exploited therapeutically. So unless there's a rule that if it's not proven, it doesn't work. Well, we've been using these plants forever, before they even invented a beaker never mind a Petri dish or a microscope. So understanding something in scientific language does not make it work any better or any worse than it has always worked, does it? Science is just another language for what happens in the world. Nothing is new, nothing is invented. Okay? The best safety for CBD is the fact that it has been used as part of hemp, as part of hemp seeds. We do need more research. I love the research. I love all those bioregulatory mechanisms. But the science is being established in order to exploit the effect. Okay? It is proven only to be exploited. So they want to have more clinical research so that they can be exploited therapeutically. And this needs money. Okay? So follow the money. What's being researched? Follow the money. Are they researching wild carrot? No, there's no money in wild carrot. So it's important to bear all those things in mind. Okay, they are extracting it, so it is important to get additional safety information. But fundamentally, what's important is that it works and that it has benefit. What you're doing with the clinical science is just measuring the therapeutic effect. Yeah? That was a short act, wasn't it? Okay, so that's the phytocannabinoid. Okay, yeah. Just getting my own bearings. Okay. You all still with me? Yeah. I wondered about, are you all okay for breathing, sitting? Yeah? My other thought for using the beach ball was to see if you're all awake. You'd have to stand up there and give it a good... Okay, you ready at the back? Well, I'm more awake anyway. Okay, so are we getting enough science, not enough? Are we getting the rounded picture? Yeah, you all still with me? Okay. So basically CBD is a food, right? We're on to CBD now, okay? So it's a food. Why is it a good food? Aha, this is where the audience participation comes in with no beach balls involved. Right, I've shown you a good few slides about hemp, what it looks like, what you do with it, what you make from it. So can anybody give a guess as to why hemp? I've showed you the seeds. Why might that be a good food? We make rope. And there is protein in it, yeah. Protein, good. Fiber. Okay. Fiber is so important just for its own sake, for regulating the hormone system. If we don't have enough fiber, we don't have enough fiber in the stool to eliminate with the bile salts all of the breakdown products of hormones. So fiber is very important before we even come to CBD. Yeah, anything else? Fiber, protein. It's a seed. Does that give you any clues? Oils, yeah. Same as evening primrose oil, same as rapeseed oil, and olive oil. So all very... that's what it does. It's not an... Yeah, I'm thinking ingredient-wise. Yeah. And omegas. Yeah, omega-3s and 6s. So enzymes, yeah. And also lots of minerals and vitamins. A seed is the germination for a new plant. It contains all of the nutrients. That's what makes them so nourishing. So they're action-packed energy. If you can let them, not ferment, what's the other word? Sprout. Yeah, that gives much more access to what's inside the seeds. Or if you grind them, it means that it breaks down the shell, particularly flax seeds. So they're just little tips. There's about 60 compounds called cannabinoids. And how it's regulated is as a food supplement. So in the same way that you would extract vanilla extract from vanilla pods, we extract CBD from hemp. CBD doesn't directly act on the receptors. It influences the body to make better use of its own endocannabinoids. I find that very reassuring. Okay? But you need to have enough of your own endocannabinoids to enhance the effect. And that's another reason why, I'll come on to it at the end, why general lifestyle is also very important. Because if you don't have your own endocannabinoids supported, taking the CBD won't be that helpful. Sure it won't. No. See, I love the logic.
Sorry, your own endocannabinoids.
Yeah.
Are we born with that and we can...
No, we make them every 3 to 4 hours in response to all of these needs within the body and the availability of constituents.
By our food and lifestyle
Yep.
and intake.
Yeah. Yeah. So the CBD enhances our own endocannabinoids. Very important point. Because it's short-acting, the supplement needs to be taken at regularly spaced out intervals throughout the day. When we come on to dosage, remember this, okay? Benefits should be evident within 20 to 30 days. I'm not so sure. If you have a very run-down, deplete, adrenal, cortisol, immunoinflammatory, mental health anxiety, I think this is related to pain. Okay, if you have straightforward arthritis pain, then you're likely to get results. But personally, thinking as a medical herbalist, I think that that's taking it out of context and possibly for one specific indication. It was just one of the articles that I read, but my experience using herbal medicines would lead me to question that. So we'll be looking for evidence as all of these actions: anti-inflammatory, antioxidant, anti-tumor, neuroprotective, anti-epileptic, antidepressant, anti-anxiety, antipsychotic, gene expression, detox or detangle, as in Alzheimer's disease, when there's knotted plaques in your brain. So what does it mean to patients? Mainly it influences sleep, your immune system, and pain, because these are the things that get us eventually to go to a herbalist or to buy something from the health food shop. So pain, since 1999, sales of prescription opioids in the US have quadrupled. Okay, I don't know why we're all in such pain. We really should not be all in such pain. Okay, there's something fundamental. Deaths from opioid prescription drugs in the States are phenomenal. And for the first time, middle-aged white people are dying younger than a generation ago, and they think a lot of that statistics is actually due to opioid prescriptions. And we're not doing very well in Ireland. The number of people addicted to solpadeine and various codeine preparations is, and it's people's next door neighbours, people's sisters, people's best friends. And it really takes its toll on your life, your quality of life, your sense of being alive, organ damage, not pretty, okay? The lymph system is very underrepresented. There's two things that herbal medicine recognises much more expansively than pharma medicine, and that's the myofascial system and the lymph system. And the myofascial system is what holds on tightly to the internal structures, particularly muscles, and there you go, there's your pain. And also the lymph system, okay? We sleep an hour and a half less every night since the rural electrification scheme. Yep. In the winter. And an hour less every night in the summer. So there's a real problem with sleep deprivation. I'm scared this thing is going to go to sleep again, which would be very good timing, wouldn't it? So sleep. If you're in chronic pain, chronic degeneration, inflammation, are you getting enough sleep? Okay. So endocannabinoids may help manage metabolic syndrome, manage more chronic immunological conditions and chronic neurological conditions. And this is the herbalist going, new? What are they talking about new? Obesity. CB1, which is the psychoactive endocannabinoids, has the opposite effect, and you get the munchies. And you store your chocolate before you take the psychoactive cannabinoids, because the chocolate enhances the effect. We knew all this before they did the science. Do you see what I mean? People know. We have learned a lot of things. Then we go to the science, and the science enhances our knowledge, and it does it very beautifully. CB2 decreases food consumption overall, and may help with weight gain, as there's a charge to the exit to make sure people... What's the thing that brings people to the doctor or the beautician or whatever? It's beauty, it's vanity and pain. Okay. So it helps, or with the metabolic syndrome, sugar and fat metabolism, all in the right direction. Does it make you skinny? No. And just for an example, another cannabinoid, which is CBG, has a neutral effect. Remember the 60 cannabinoids. So you're getting the idea of the complexity. This slide is a bit detailed because it talks about immune privilege. And there's a balance between inflammation, injury, and staying alive. And that is played out on a daily, momentary basis in the brain. Too much excitement in the brain is bad, immune excitement, because it can destroy the brain tissue. If you have too much inflammation in the brain, inflammation causes swelling. Brain cells don't do very well when they're swollen. Okay? So you can get more damage than protection. And it's a constant balance. And CBD modulates transmitter communication between cells in the brain. It protects them from an overzealous immune system. And they maintain the well-controlled and finely tuned balance of immune reactions in pathological conditions. So overzealousness can be... And what else illustrates an overzealous immune system? Autoimmune, yeah, and allergies, hay fever. So this is just the immune privilege is demonstrated most beautifully in brain cells, but in brain tissue. But it also, overexcited immune system is a modern, the amount of it, the incidence of it, morbidity from it is way more than when I was growing up. Okay. So when you're talking about mental health, CB2 is where it's at. Forget CB1. That just causes problems. I did put in that it caused headaches, but that would be a misrepresentation. So you don't get the psychoactivity that plagues CB1 directed therapies. So it's very good overall that CB2 is the one that's extracted in foods and has so little problems when it comes to inflammation and mental health issues in particular. So CB2 effects are in nervous tissue, reducing inflammation, hypersensitivity in muscles, joints and skin disorders in particular. These are the two faces of chronic pain. People think that when I Googled images for pain, everybody came up with, oh God, and oh, and toothache, and, oh, but it's not. This is, I'm screaming inside, but there's no point in saying anything and getting on with it. And it's almost like an over-bright, over-smile of keeping up resources, right? And many people live like this every day. This is when people are talking to somebody and they're in company, and this is when they're on their own. This is when they're sitting on a rock going, Jesus, I feel shit and I'm absolutely knackered, right? So chronic pain isn't as dramatic as you would think. It's chronic, it's there every day, and people have to get up and get on with it, yeah? Think all of the autoimmune conditions, think of osteoarthritis, think of all kinds of things. A lot of people, older people, cope with pain unnecessarily. One common thing is lack of vitamin D. which can give people sore muscles. And combined with a bit of osteoarthritis, people put down all the pain to the osteoarthritis. But a lot of our older population are very deficient in vitamin D. And they think it's just age is the reason. We've talked about the increasing the anandamide, the immune modulation, and there's one animal study. See, previously I was talking about endocannabinoids. This is evidence for CBD. There's one animal study for a topical gel, but otherwise the studies have demonstrated these other actions for actual CBD. Okay. Reducing inflammation and thickened artery walls. How relevant is that? Cancer. A lot of the hype around CBD is around cancer. Plant cannabinoids, including marijuana, and also our own cannabinoids. So look after your own cannabinoids before you go buying supplements. They're anti-inflammatory, anti-proliferative, anti-invasive, anti-cancer spreading, and promote programmed cell death in most cancers. At present, cannabinoid cancer therapy is limited to nausea and pain. Future studies are needed to determine its full chemotherapeutic potential. But why wait? Okay? Balance the risk versus probable benefit. If you're preventing cancer, if you're post-cancer treatment, there's absolutely no problem in taking CBD. If you're on treatment, you might want to discuss it. Well, you would want to discuss it with your oncologist. If you're between courses of treatment, I don't see any problem with it. There is one case history of somebody who had melanoma, who responded. He had a glioblastoma in the brain, and he responded much better to radiotherapy than if he hadn't been taking it. But it's very limited research. I'm certainly not advocating it, but it is being used. But for all of those other indications, absolutely no problem. This was in an expert opinion investigating drugs 2016 on phyto, endo, and synthetic cannabinoids, promising chemotherapeutic agents in the treatment of breast and prostate cancer. Expert opinion summary was the cannabinoids, in particular the non-psychoactive CBD, may be promising tools for combination therapy for breast and prostate cancer due to their direct anti-tumor effects and their ability to improve the efficacy of conventional anti-tumor drugs and their usefulness as palliative treatment. Nevertheless, and I could put this nevertheless at the end of every study into every herb, okay? Nevertheless, I could say it off by heart. Deeper studies to fully establish the mechanisms responsible for their anti-tumor and pro-tumor properties and their formulation and efficient delivery systems remain to be established. So we don't quite know what they do. Will we ever quite know what any of it does? Okay? I don't see any reason for it. All of the previous actions, plus the synergy with other treatments. Okay? Like if you combine that with the synergy of anti-tumor, inflammatory effects of turmeric. Particularly, this is where there's a strong family history of cancer. We're talking prevention, early diagnosis, post-diagnosis. You see, cancer isn't just something that happens. You go to the doctor, you have an oncologist. Why did that start? You know, is anybody addressing that? Why did you end up in that situation? And if you get one cancer, you're more likely to get a recurrence. So you don't want to be sitting there going, oh, that's all right, so, do you? Well, I wouldn't. You know, you'd want to do something to make sure you'd want to be eating more greens and brassicas because they have the indole constituents that are anti-cancer. So there are certain things that you can do in order to look after yourself. So all of this to do with cancer is collaborative care. For people with very severe cancer, I refer them to a colleague in the States called Jonathan Treasure, he's a genius, but he goes into, a lot of the cancer therapies actually come from herbs, right? I don't have specialist knowledge, but I work in collaboration with Jonathan Treasure. And he has written a book on cannabis sativa. He is a worldwide expert on it. So for somebody who's in that situation, liver, again, you're sick of hearing the word inflammation, aren't you? Anti-inflammatory. Targeting the hepatic endocannabinoid system may have therapeutic potential in a variety of diseases. The job of the liver is to detox everything, particularly that comes into your gut. So all the herbicides, pesticides, alcohol molecules, and the volume. If you're eating too much, you're in trouble with your liver because you're just slamming it over and over again. Too many calories are a problem. Sugar is a big problem. Too much sugar is actually toxic. Fatty liver disease is epidemic proportions. All right. There's going to be more cirrhosis soon from fatty liver disease, from inappropriate diet, than there will be from alcohol. But having said that, 49% of acute liver damage is actually due to paracetamol or acetaminophen. Who's American here? Thanks. Acetaminophen. So, but the chronic fatty liver disease, the liver departments are inundated, okay, and it's actually ending up in cirrhosis. It's about respecting ourselves. It's not about throwing CBD onto something where we don't know what else we're doing. There's a certain amount of housekeeping and keeping trust with ourselves, really, because we are what there is that we know of walking around. So we need to think about what we need as well as what we want. Yeah? My mother says everything in moderation, including moderation. And she's good at going to parties. So it's not asceticism for its own sake. It's actually understanding that our physical presence is as important as our brain. Okay, a lot of us live in our brain, and we are divorced from ourselves from here down. Is there any nodding heads here? Or am I the only one? Yeah, it's hard, isn't it? So reproduction, I covered that a bit before. Normal functioning of reproductive cells is influenced by the body-brain stress response. Too complicated to give a simple summary effect. If you're having difficulty with reproduction, if any of you want to know why to take all of this seriously, there's a 40% reduction in male sperm productivity, output, whatever you want, or maybe even fun, getting it where it needs to be. But it's affecting, if that's the effect on male sperm over the last 60 years of stuff that we must be internalizing one way or the other through breathing, diet. Okay, can anybody think of any other, like thinking too much? Yeah. So that's how it's like when I show you the liver, that's what the liver is coping with. So, and you really, for these complex things, it is about unpacking them in a context that you can actually deal with them, like I said in the video, in ways that are everyday incorporated, so that over a year or 2 years, you're actually living more in tune with what your body needs and how it can respond. Does that make sense? Yeah. So that's for kind of chronic inflammation. For lots of minor things, it's much shorter. Reproduction, don't wait until you've been to the IVF clinic for 6 IVF sessions to see a herbalist. The minute you think, we're in problems here, that's when to see the herbalist. And the herbalist sees you through. The herbalist will be going, right, okay, you're 39, let's get you organised every which way but loose, and this is what we can do. If you're 31, you're getting all the things in the right place early, okay? It's very, very important to leave time for things to work. Okay, it takes time to get into this situation. It takes time to get out of it. Strong bones, CB2, very important for strong bones, our own endocannabinoids. We have to move the muscles on our bones to get the calcium in there and the magnesium and the potassium and all the rest of it. So the receptors are abundant in cells that bind up bone and recycle bone. Here's some good news. With CBD, if you have inflammation due to any of these conditions, then once you find a dose that's helpful, you don't have to keep building it and building it and building it. You've no tolerance effect, which means that it's increasing tolerance is typical of things that are addictive. So there's no addictive qualities with CBD. Few long-term studies have been done, but they've been used for thousands of years. And the recent science, even within its limitations, offers a reassuring, comprehensive narrative. That's a good description of the role of science. Synthetic pharmaceutical alternatives, known toxicity, severe side effects, cumulative damage, and addictive nature. Boy, do they make CBD look good. This was an exhibition that went from cradle to grave, and it was an accurate representation for both men and women of how we engage with pharmaceuticals from cradle to grave. Okay? In childhood, it's vaccines, it's Calpol, it's antibiotics. You go on to the teenage years and it's antibiotics for acne. You go on to the pill, you go on to, and obviously then it gets more and more, and it has escalated. I think this was about 10 years ago. So from cradle to grave, you would not believe how much goes in for all of us. You know, I mean, if I have a severe toothache, believe me, I'll be taking one of these. Actually, it'll be the second thing I will do, but I don't like pain. I'm a coward. This is the number of deaths from prescription drugs. This is from the CDC, so you can't get, this is not a hype, okay? And this is going up exponentially since 2014. The fourth biggest killer is pharmaceutical drugs. Why does that not make people do something different? I would love to know. I'll tell you what I'd love to know. Somebody goes to the doctor, they say the doctor says, we've done all the tests, you've got high cholesterol, your dad had a heart attack when he was 70, you need to go on statins. And people go, good, here's the prescription. They start off, no side effects. Many people don't have side effects. And there's no questions. How long will you be on it till the rest of your life? People go to a herbalist and they go, how long will I be taking the herbs? And I say, a year, 18 months, you know, and they go, really? And I go, yeah. It's a completely different mindset. Why people expect a few little itty bitty herbs to do something in 6 weeks that drugs won't do, because they stop working the minute you stop taking them. Okay? With the herbs, as you go along, you need less and less of them, right? In general, right? There's a mismatch with herbal medicine. The people who come to see us in the clinic are the ones who are up against the wall. They've tried everything. They've tried the biologics, they've tried the anti-inflammatories, they've been on steroids, they've tried everything. And they either have too many side effects, or they get worried, or they come and see us at the end of the line. I want to see people, and so does Lara, my colleague, who's here somewhere. We want to see people for mild to moderate problems early rather than late. We want to see the chronic sinusitis. We want to see the acne before people give them Roaccutane or long-term antibiotics. The PMS, which means people aren't doing their exams properly. The mild anxiety and depression. That's the most suitable terrain for herbal medicine. Yeah? You want to tell all your friends and family? Going to get the message out there? It's not end of the road medicine. Yes, if you're at the end of the road medicine, we will do everything we can to help. If it's mild to moderate and early, then I'll be talking 3 to 6 months. If it's severe, ongoing, up against the wall, you'll be lucky to get away with 2 years. But don't be surprised. Don't expect what can't be done by sledgehammers on those bioregulatory underground systems. Okay? What herbal medicine does is it takes those bioregulations and it nudges one here, nudges one there. In the middle of the beach ball, something goes, tweaks, and it sends a better signal. And does that make sense? Okay. And it's the same with CBD. So good terrain for the CBD to work, you'll get much better effect. Okay. So Cinderella diseases, endometriosis, fibromyalgia, osteoarthritis, insomnia, memory, neurodegenerative processes, including Lyme's disease. CBD is likely to be beneficial, and there's some evidence for them. Sorry? Because they're the ones that don't get to go to the ball. They're the ones that are there's no clear treatment for. And you just keep going back, and everybody is doing their best, but there's really no answer. Yeah. The role in addiction is promising, very few studies. But if you're addicted to painkillers like codeine, you can see where it does a double job. It's anti-inflammatory for your pain, and it calms down all of the pituitary, hypothalamic, chronic stress, cortisol reaction. It does all of those things double over. But also for alcohol addiction, food addiction, particularly related to high processed foods, drugs and smoking. I think there's a role, certainly, even if the evidence is, even if they haven't counted the bodies. You see, nobody is going to put that amount, they're not going to put 5,000 people with cigarettes, not cigarettes. Very, very expensive to do those kinds of studies, and there isn't enough money in it. Okay, that's the big deal. There isn't enough money in it. Some money in it, but not enough. So with any of these addictions, you have regulation of anxiety, mood symptoms, pain and insomnia. Why are we addicted to all these things? Because of anxiety, mood symptoms, pain and insomnia. So if you deal with the underlying problems, you're likely to get benefit. Epilepsy is close to my heart because my son has epilepsy, so you can imagine I was reading all of this with a fine tooth comb. The first diagnosis of epilepsy, the first use of using marijuana plant is in Assyrian clay tablets from the 7th century BCE. A review of CBD has noted anti-seizure properties. Problems. All of the studies are done on the most severe epilepsy. Another problem, most severe, or epilepsy that's unresponsive to other treatments. And they use a very high dose and a very expensive dose of CBD. So for somebody to buy that amount of CBD, you'd want to be, fairly well healed. These are researched independent of any lifestyle advice. And if you ask any nurse practitioner in an epilepsy clinic, what's the best advice for somebody with epilepsy? It's sleep. Okay. People are much more vulnerable to epilepsy convulsions if they haven't had enough sleep. Also, if they've taken any toxic substances. There are no studies on changing from epilepsy medication to CBD. There are no studies on adding CBD to a first-line medication instead of a multiple drug regimen. So a lot of the information isn't there, unfortunately. The evidence that is there is indicating that the likely role of optimum blends of THC and CBD. I told you how complex they were, the 60 cannabinoids, and it seems likely that that epilepsy will benefit most from a combination of CB1 and CB2. So it would need to be under the care of somebody who is licensed to prescribe medical tetracannabinoids. The same goes for cancer. It's likely that epilepsy management will combine both, and it will be under medical intervention and guided by the research. So CBD, but the other thing is a lot of people have secondary CBD. Oh, I forgot to think about, did I do this? 1 in 26 of us will have epilepsy by the end of our lives. 28% approximately are unresponsive to the drugs. Okay, so it's a big problem. And the drugs have problems. And there's no change in how effective the drugs are over the last 30 to 50 years. Okay, so we are not going anywhere fast or far in dealing with epilepsy. All kinds of, it creates a lot of life problems. Psychosis, way too big, way too few studies. There is but it comes down to the immune inflammatory brain. Okay, if you got that picture and that beach ball full of neuroregulatory whatever, it does seem to be safe and effective in treating patients with schizophrenia. but the research is very limited, issues are very complicated, and each person is unique. Okay, I don't have any experience of doing it, of using it in this way. Depression is involved in the inflammatory terrain. Okay, it's and anxiety disorders are highly comorbid with depression, which has recurrently been associated with immune dysregulation. However, unlike depression, very few studies have investigated the relationship between anxiety disorders and inflammation. But to do with all of this aspect, you're definitely talking better CB2 effects than CB1. These are small studies, okay, into social anxiety disorder, social anxiety, anti-anxiety and antidepressants. I'm not going to go through them individually. If any of you want the slides, leave your email and we'll send you the slides. These are small studies: obsessive compulsive disorder, post-traumatic stress disorder. The data on long-term use is limited. Okay. Another post-traumatic stress in a child. Okay, but there are cautions with children. We really don't know the effects of them. Drugs for anxiety have considerable unwanted side effects, including addiction. Consult a medical herbalist if you want to use herbal medicines. Why? Because there are so many other herbs that are good as well. St. John's wort has shown to be as effective as SSRIs, which used to be a comfort until they proved that SSRIs, actually when they took all of the clinical research into effect, that they are no better than a placebo. But because of the wide actions of St. John's wort, again as a multi-platform for raising more than one regulatory system, it's certainly, as a herbalist, we use it as a restorative for the nervous system, along with wild oats and lots of other herbs. So that's why I would suggest that if you have mental health issues of the mild to moderate nature, okay, that this is a very, very useful route. Type 1 diabetes. The interesting thing about this is the small studies that they did on diabetes shows that there's a protective effect of autoimmunity. They specifically looked at an autoimmune condition. Early studies show that it may protect the pancreas islet insulin producing cells from immune damage. It may also help with neuropathic pain, and neuropathic pain is not, it's terrible, right? It is gnawing is probably a good description. I would recommend using CBD with other herbs and spices, including fenugreek and cinnamon, for long-term management for diabetes mellitus. However, again, see a medical herbalist, because that's a very serious condition. Okay, acne is inflammatory and overworked sebaceous glands, influenced by hormones. I combine them with Dr. Clare's apothecary range for skin, which includes a tea and a tincture, good food and plenty of water. But if it's moderate to severe, I probably would add in CBD, and there is a small amount of research based on it. So, Alzheimer's disease. These are glial cells. Anybody know what macrophages are? They're the scavenger cells in the immune system, and they up all of the debris that's left over from inflammation. So these are the equivalent in the brain. Aren't they beautiful? So they're immune macrophages. They make up 10 to 15% of the brain. I loved this proof of principle. If it's historically been used in this way, if it behaves the way it's described historically, if the constituents match the behavior, and whatever possible clinical studies are available, well, then that's all proof of principle, okay, which is a very nice description. So this was Frontiers of Pharmacology. In order to get medicine to move, medicine is like a super tanker, okay, trying to get a super tanker to change direction by 1 degree, it takes 100 miles, okay? Trying to get medicine to move takes 5 years, okay? Because it's very, very entrenched, very institutionalized. So this is a Frontiers in Pharmacology early this year, and what's exciting is it looks at in vivo evidence for therapeutic properties. So this is along cell lines. It's not just in the Petri dish, it's a little bit further on. For therapeutic properties, oh no, what did I do? It's like all the quiz shows. It's different when you're up here, you know. In vivo evidence for therapeutic properties of CBD for Alzheimer's disease. The studies provide proof of principle that CBD and possibly CBD and the THC, which is the tetrahydrocannabinoids, combinations are valid candidates for novel Alzheimer's disease therapies. So, I mean, if I start losing my marbles, I'll be taking CBD. Because all of the ground rules are there, the logic is there, the history is there, the evidence is there, and the safety is there. Okay, thanks. So potential unwanted, I could find very few. Research specifically on cannabidiol has found few or no negative side effects, well tolerated across a wide dose range. This means it may be a good option for people who don't tolerate the side effects of other medications, including addiction, for example, to anxiety medication. But I would say they'd be suitable for people before they even go there. There have been no significant nervous system unwanted effects or effects on vital signs or mood among people who use it, even in relatively high doses. And I'll come on to that. The most common side effect is tiredness. Some people have noticed diarrhea and changes in appetite and weight. And there are very little long-term safety. Trials have been on a small scale. Tests have not been carried out on children or during pregnancy or breastfeeding. As with any new or alternative treatment option, a patient should discuss it with a qualified healthcare practitioner. Endocannabinoids play an important part of brain development from conception to maturity following adolescence. This should be taken into account when interpreting the wisdom of any intervention. So for pregnancy, breastfeeding, children and up to young adults, if I'm using herbs, there has to be a darn good reason. I'd have no problem using endocannabinoids as opposed to long-term antibiotics, because I know the harm in an adolescent where you've only got 5% less of potential brain development. So it depends on the evidence, risk, benefit, and it would also be after I've changed food and lifestyle and all of those things. But it is a complex substance. So how much and how often? This is what's very frustrating. It's a food, nobody can describe a dosage, so I'll just give you the best information that I can. And the best information is you want to use as little as possible, as frequently as necessary. You can all go home now. So you titrate from a low dose. Titrate is to try a low dose, see if it works, increase the dose until you get an effect. Once you get an effect and it's stable, then you can try titrating it down, because at some stage, hopefully the job will be done and you no longer need it. There's no tolerance. Once you find an effective dose, you shouldn't anticipate that you need more and more and more. Healthy lifestyle. I put in blah, 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 because you're going to tell me what the healthy lifestyle is. We're going to have some audience participation. Food, yeah. Good food, 3-4 times a day. Make sure you have breakfast. Have a good breakfast, a big dinner, a lighter supper, and good food. Yeah. Exercise, movement, dancing, going up the stairs, never mind the escalators. Yeah. Fresh air. Water. Meditation. Sleep. Sleep is a big one. Yeah. Anybody know why we know all this stuff? Anybody know why we don't follow our own advice? Lazy. Okay. Advertising. Yeah. Delayed gratification is a huge one. Yeah. We know that it'll be better for us in 5 years or 10 years. And it's very hard to imagine that. People who have the best willpower are the people who can imagine their lives. But we need to be a little bit above par in order to be able to do that, don't we? Yeah. And I think that's why having help, I have great fun in my clinics because I think medicine should be enjoyable. I think having an ally is a good thing to have in life. And that's how I see a medical herbalist and a lot of other practitioners who enhance our sense of well-being and give us a bit of energy in order to go on and put some of these things into effect for ourselves. So the benefits of hemp seeds, so you're all going to be eating hemp seeds, healthy lifestyle, and black pepper and turmeric, just to remind you of the synergy. Putting in small good habits all have a synergistic, so if you have 2 small good habits together, they make more than their sum total. So you keep adding small good habits to small good habits. But if you need help, if you've got into significant trouble with your health, it's awful difficult. I have to go to other people to help with my health, all right? So it's good to have allies in looking after ourselves. Why is it that we think if 1 twice a day works, oh no, we want to go for the 2 twice a day? And if the 10 milligrams twice a day comes in a 50 milligrams, about the dosage, the vast majority of my patients, they start with we have a tablet form, which is a micro gel formula, which is the whole plant, which is the best that I can find. I'll come on to that. But we find that the 10 milligrams twice a day, and then you build it up from there. If you want to build it up, you go 10 milligrams 3 times a day. If it's too hard to get compliance with 10 milligrams 3 times a day, I would go to 2 in the morning and 2 at night. We're creatures of habit, and compliance is terribly difficult. You can go 2 in the morning and 1 at night. If you have more insomnia, then take the 1 in the morning and 2 at night. You're getting the drift. Most of my patients are fine on like 2 twice a day, maybe 3 twice a day. If you're going higher than that, you're up to the 50 milligrams. Most of the people who are on the 50 milligrams, it's very, very severe. You're talking people who are cancer patients with all of the provisos that I gave you, or very entrenched neurodegenerative problems like Parkinson's disease or chronic Lyme's disease. But again, they would be starting from the 10 milligrams twice a day. For very severe cancer, possibly the 50 milligrams from this straight off. But if you've that severe a condition, I would recommend that you see a medical herbalist in order to make sure all of the other things, which are equally important. Just because we throw money at something doesn't mean it's the best medicine. The best medicine is getting that enhanced benefit behind it. Okay? So, I think I've covered all of this. Watch for unwanted effects. Consult your health advisor. Over 150 milligrams is it's not that there's a higher dose, because the toxicology limit shows no established lethal CBD dose. But I don't think you'd be getting, I think you'd want to be looking after your own endocannabinoids rather than taking CBD. Does that make sense? Yeah. These are the Mayo Clinic recommended doses, or it's adapted from them. So you can see we're treating chronic pain. Most of us will be taking it for chronic pain, chronic inflammation, insomnia, the epilepsy. You can see epilepsy 200 to 300 milligrams CBD by mouth for up to 4 to 5 months, and that didn't show any harmful effects. And that's a massive dose, okay? Movement problems, Huntington's. See, these are the conditions that there's actually been research on, because they're patients attending a centralized clinic and somebody is interested in doing it. Atopic dermatitis, hemp seeds and hemp seed oil in the diet, because obviously there was a study on that. Multiple sclerosis, this is the researched amount. Schizophrenia, the researched amount. Please make sure you consult a medical practitioner. There's also evidence for it being used in glaucoma. To increase appetite in cancer patients, 2.5 milligrams of THC. That's the tetrahydro, that's the CB1 receptor. So it's very hard to get information about dosages. Doctors are very confused about it. The public is very confused about it. And that's the best sense that I can make of it. Okay? The other interesting thing is, the soil ones didn't come out that well. but you get the drift. Hemp is also used to remediate soil that has been contaminated with heavy metals. And one of the reasons why it's so high in nutrients is that it digs deep and brings them up, but it also brings up a lot of toxics. So it's very important to know where it came from, and that the company does toxicology on it. And the variety of hemp is also very important in terms of the extraction levels of CBD. So when you're looking for a CBD product, you want, and this wasn't on the list, you get these lists and you kind of go, oh yeah, right, that's one. And when I looked through the list, it was kind of like, none of them said, the most important thing is that you have quality hemp. They were all about these big words about what not to add and what not to process it with, but none of them actually said, you need bloody good hemp to start with. So clear labelling, preferably organic, clear labelling showing the quantity, the manufacturing date, no nasty ingredients. They should be verified for consistency, freedom from mold, bacteria, pesticides, solvent residues, avoid extraction solvent. Okay, so obviously the one that I stock is the one that I could find that's the best use, that covers all of these to the best satisfaction that I could find. Food-drug interactions, unlikely to cause any with other foods, but like many other foods, it's metabolized by the same enzyme systems in the liver as drugs. Caution should be exercised for drugs with a narrow therapeutic index. These are, for instance, antiviral medication, chemotherapy, and anticoagulants. Having said that, that's theoretical. No serious interactions have been noted. But theoretically, when they look at that underground map of all the things that are happening, all the enzyme systems in the liver are used by CBD in common with other drugs. So if you have a drug where a little bit of altered metabolism might mean that the amount of the drug is reduced or increased, that might be, if it's a critical drug, or if the amount is titrated and very close to a dangerous amount, you need to be very careful. Okay? So they're the medications that are likely to fall into that category. Wrong one. There's a possibility for any serious sports people, there's a possible cross-reaction on drug testing. Haha, we're near the end. This is Tower Bridge in London. What's that in the foreground? There's a resistance group called Feed the Birds, because it's not illegal to own cannabis seeds, and it's not illegal to feed the birds. So this is a protest against the restriction on growing hemp. And hemp is non-psychoactive. So it's a protest at the legislation which makes this, which means that people aren't free to grow hemp. They actually have to have a license, even though it's not offending any drug properties or substances or whatever.
Two different plants.
One is the wild. Remember we did the wild rose?
Yes.
The hemp is the equivalent of the wild rose.
Right.
The wild rose doesn't have a very strong scent because it's not been bred for it. The cannabis sativa is a different variety and it's been highly bred. There's hundreds of different hybrids of this plant. For complexity, it's a pretty good one. The curious thing is, why is this one plant breedable for this particular psychoactive substance? And it's unique in the plant world to having that amount. So that is very interesting.
Sorry, so hemp is like the umbrella term for the different types of cannabis?
Cannabis sativa is the parent plant. Hemp is the original one. And then various hybrids have meant that, like the original wild oats look nothing like what Quaker oats grow, okay, because they've been hybridized. It's not genetic engineering, it's just they've crossbred different varieties so that they have different properties.
What does the CBD come from then, the hemp or the cannabis?
Hemp.
Oh.
Hemp. It's not illegal. You need a special license to grow it, but it's not. It doesn't produce any psychoactive properties.
And this
Yeah.
THC.
Yeah. Yeah. Good. Everybody got that? Yeah. So this was I bought a book when I was in India on Indian plants, and this was one of the things in it for under the hemp. In England, it not infrequently found as casual weed in gardens, being frequently the offspring of seed from the cleaning of bird cages. So it's just one of those things how it goes from centuries to generation to localities to hybridized to legal enforcement agencies. There's big evidence that the real problem with hemp is that it was cheaper and better than cotton. And it's all linked in with slavery and legislation and all of that. So it's complicated for political reasons as well. And the hemp got all caught up in the middle of it. So, great. Any questions?
How do you decide in treating a patient for, say, anti-inflammatory
Yeah.
to use CBD as opposed to another type of herb?
See, the first thing to do is to look at who this person is and why they're in difficulties. And the difficulty might be food, the difficulty might be their digestion, the difficulty might be, they're two big ones, not enough sleep. So CBD, a lot would depend on the severity, their budget. We're very practical down in Health and Herbs. Their budget and priorities. You know, it might be that a blend of herbs for 3 months would mean that you would build up the endocannabinoid background, and then you might go, you know what, now I think is the right time for introducing CBD. I think you'll get the most benefit from it. For other people, chronic fibromyalgia, endometriosis, polycystic ovarian syndrome, all of these, they're not mentioned here because nobody has researched them. But when you understand the bioregulatory pathways and the migratory, like endometriosis comes to mind because of the way it's spread, which is probably something like the macrophage spread. The microglia in the brain are a big part of how breast cancer is spread. And in terms of cancers, I would be more favourable to using them with breast and prostate cancer. Again, when you look at the influence on reproductive hormones and the liver and macrophages, then I'm taking it's as a herbalist, it is like the beach ball. You're kind of going, right, which is core, which is proximal, and which is distant. So what's the core function, and then core dysfunction, and then you're also dealing with the satellites of symptoms. You know, because obviously, if you don't treat patients' symptoms, they won't come back. It's as simple as, right? So at the same time, and bring everything together as a medical herbalist. But I don't see any reason. It's a food. Let's not get. It's not that exciting. Do you know what I mean? If you're trying a lot of things yourself and you just seem particularly stuck and your diet is pretty good, or you're so anxious and moody that you can't stabilize your diet, you know, there's a role for it there. So the important thing is to kind of have a clear reason for using it. I would say give it 2 to 3 months rather than 20 to 30 days. If it's for osteoarthritis, then I would say, you know, you probably would get it between up to 6 weeks, but I wouldn't keep taking it 4 months later if it's simple osteoarthritis. But lots of other things help osteoarthritis as well.
Would you have any use with ASD, you know, in children, autistic spectrum disorders?
Autistic,
Yeah.
Absolutely, yeah. Along with diet and gut, huge role of the gut and the microbiome, absolutely, yeah.
For somebody who is on a lot of opiates and they've kind of a poor digestion, like what you were saying, just to build up their own kind of,
Yeah.
that's probably the best step first, is it, before you would jump ahead and go?
I would, yes. And plenty of hemp seeds in the diet.
What's a good hemp seed?
What's a good hemp seed?
Yeah, is it the milled or whole?
Anyway, you can take them. I mean, probably the best is sprouted. All the seeds are better sprouted. And if you want to mill them, if you want to grind them and use them immediately. Don't store the ground ones because they lose their volatile oils, and the volatile oils are rich in the CBD.
What about the packet ones you get, the Linwood?
Oh yeah, they're great. Yeah, that's them.
Bunelin, it's organic.
Bunelin, yeah.
Whole is better, and then grind.
Whole is better and then grind. Yeah, for all of the seeds.
Yeah.
And sprouting is better again. Yeah.
And if you take alongside anti-inflammatories, and if you take them with anti-inflammatories,
They can be taken with anti-inflammatories, and hopefully you can reduce the anti-inflammatories. That's a very good use. Yeah, brilliant. Yeah, for reducing pain relief.
I get bad insomnia at certain times of the month, one particular week of the month, and you said build it up over months. Can you use it long term just sometimes?
Why don't you try it? Nobody has done that study. You can be an N=1 study and let us know how you get on. I mean, I don't see why not. For a lot of people with arthritis, they get sleep interruptions because of pain. So if you're taking CBD for your pain, you may very well sleep better. So over 3 months, you might then be able to reduce the CBD. So it's more important to have a plan for what you're doing and how you're doing it, rather than it's just the latest thing, because the media have to find something to talk about.
Long term.
Yeah.
Just wondering, do you use wild lettuce at all?
I do. Yeah.
How do you find wild lettuce works as opposed to St. John's?
Wild lettuce is good for, I use it mainly for sedating, for sleep. I would use it with other herbs, like Californian poppy would be a good blend, and St. John's wort, and wild oats, and chamomile, and valerian, so a blend of herbs. I don't use it by itself, and I'm wary of using it in people who have clinical depression. It's too heavy. It's quite a heavy herb to use. I don't use that much of it. I use a lot more passiflora and skullcap and chamomile, because for many of us, the problem with sleep is that we're too alert when we go to bed. It's not that we need a sledgehammer. We actually need to chill sideways rather than have a bang on the head. What? Hops, yeah. Same. They're both very heavy. Yeah, I'd lighten them with wild oats, for sure, and chamomile. Because anxiety is more of a problem than sedation. Yeah. There is evidence of use in Parkinson's, and it actually makes a lot of sense in Parkinson's and Alzheimer's. But the amount of studies with it are very poor. But particularly for early onset of Parkinson's, because you really want to delay introducing drugs as long as possible. And I don't see any problem in letting them help the drugs either. The other thing that I use for Parkinson's is coenzyme Q10, at least 100 milligrams a day. And pay attention as well to toxins. You want an absolutely clear diet. And the amount of stuff we get from plastics, like from dashboards of cars, and is phenomenal. So Parkinson's is being diagnosed earlier and earlier. Alzheimer's is being diagnosed earlier and earlier. This really is about holding on to function, maximizing function for as long as possible, as often as possible.
Sorry, I have rheumatoid arthritis.
Yeah.
Steroids. Could I use some oil with the steroids?
Yeah, there's no contraindication that we know of, and it's a food. Yeah.
for the pain.
Yeah.
Don't be in pain all the time.
Good. Anybody else?
Did you say you're making you have capsules rather than the oil?
Yeah.
Yeah.
It's a microgel formula. It uses the whole herb. It's organic, and the company owns it's like from soil to product, and it's to good GMP. The other problem is that there's so much stuff out there. When something hits a zeitgeist like that, it's very easy to. It might be less expensive, but you would.
Evergreen, they're selling the oil now, and I was wondering about the quality of that, because I'd heard of this company before who were
Yeah.
for people to give over land so they could grow hemp on
Yeah,
it in
yeah.
Ireland, and they've obviously found that now.
Yeah,
It doesn't
Yeah.
seem to state on the bottle what the concentration is of it.
I know.
It seems to be very mild.
Yeah. I mean, that's why, that's why I went with this company. And people do come in and say, why is it so expensive? Because doing all of that is expensive. That's why it's more expensive.
So the oil is more effective, say, if you had the plant?
No, this does have the oil in it. This has pure CBD from the oil, and the oil extract is in a micro gel
Yeah.
formula inside the capsule.
So using the whole plant wouldn't be as beneficial as...
No, it's more beneficial.
It's more beneficial.
Yeah,
More
because it's pure CBD. It's not diluted in an oil.
Yeah.
Yeah. A lot of the oil, it's the constituent added to hemp oil,
Yeah.
which is not necessarily what you want.
So if you grew your own and dried your own, it would be more effective if you're prescribed.
Yeah, you need a license to grow it.
Yeah,
Yeah.
but if you did.
If you did, it would be useful. Yeah, it would be helpful. Yeah. I like the whole plant.
Yes.
This is a way of using the whole plant, microgelled, including the oil, microgelled in a way that it's also very convenient.
Yes.
You know, I have used the cannabinoid oil, and it's this is much easier, right? And I've done the 3 teaspoon tea bags because I just can no longer spend energy persuading people to make tea. So yeah, okay. One more question.
What's the retail price on it?
What's the retail price?
So for 10 mgs, which would be your dosage, there's 30 capsules in a pack. It retails at $49.99. So that's the expense that you're talking about.
Yeah.
It's the quality, it's farmer grade, it's tested, it's laboratory tested, it's made in Switzerland. And for 50 mg, which is the next highest strength that we do, it's $199 for 30 caps. So you'd be taking a maximum of 2 a day. That's what is recommended. So it really depends on your condition, depends on how severe your pain is, and what it is you're looking to support from a treatment point of view.
So in other words, you can start with 1 a day, titrate it up from there.
So like we talk about 400 a month, or 500 for the 2 a day,
For the 50 mg, it would be,
400 a month.
yeah. Well, you start,
But very few people would need that.
yeah,
Yeah, very few people would need that.
yeah.
So you'd start...
No, and 50 milligrams 1 a day might well be okay. Yeah, that's why the epilepsy, that the researched epilepsy dose is completely unsustainable. Yeah.
Is it useful as a preventative, like as in taking steps like earlier on in terms of trying to work against Alzheimer's or that, just taking it as a kind of building yourself up?
I don't think so. No, I think if you want to maintain all of your neuroprotective aspects in your brain, you're much better off with exercise, food, including hemp, including the essential fatty acids, and being happy. Mindfulness and being living your life as your whole essence. There's no magic formula for this. There really isn't. I would love to tell you what it is, what the magic formula is, and that it was only a tenner a month. Wouldn't that be wonderful? And all of the things, all of the other spices that contain the endocannabinoids, which I only read about today, so I didn't get them on there, are the cloves, basil, oregano. They all have these beta-carotenoids as well. Okay. As the cacao and the Echinacea. So it's not the only plant that does this, and supporting your endocannabinoids is first, and then you go. So the 50 milligram tablets would be after minding your endocannabinoids, starting with the lower doses, and then in a small number of people, the 50 milligrams is available for you. But you don't jump in there. Okay? And you start with one a day and you build up. Okay. If anybody, I'll stay here if anybody wants to ask me any other questions, but you've all been brilliant. Can you give yourselves a round of applause? Thank you.